The One of my patients said to me yesterday that they were really anxious about a third wave. And I remember thinking before the second wave came, and the restrictions associated with it, that we perhaps would avoid that. And I was in contact with friends in Melbourne who were going through a second period of lockdown, commenting that I wasn't sure I could do it again. But actually, as a population, we're fairly resilient. I think if we have to go through more lockdowns, we will, and with much the same success that we have done already, with more of society carrying on. One of the big questions for me is international travel, and the kind of things that we're unsure about in terms of the medical profession more broadly is how will our conferences look in the future? How will we function as Royal Colleges in the future? And I guess some things will return and some things will be different. How many days a week are office-based workers likely to be in the office for? Now, there are some companies wanting everyone to be in, some companies saying that nobody should be in, and I suspect most companies are going for a hybrid model of people coming in 2 to 3 days a week. But how then do we use face-to-face? If I'm having committee meetings, mostly which can function on electronic means, there seems to be a real desire to have a face-to-face meeting periodically. But then what do I put into the content of that face-to-face meeting periodically to make it different from the electronic meetings and get the most out of the social interaction? So I guess this gets back to a really interesting observation, which is in our modern age, what's the function of that social interaction? And we're missing it, but I'm not sure we fully understand why we're missing it.